So we're going to start talking about traumatic brain injuries and some of the relevant neuroanatomy and physiology. So the brain is like this soft mass that's inside a bowl of water with a hard cranium on the outside. And so when your head jerks from side to side, the brain goes back and forth, and there's a potential that it bumps into the hard cranium. Now, the other thing that's important to remember is that when we're born, our skull is in multiple pieces, so we can fit out of the birth canal, but then it fuses. And so after the skull bones fuse, if there is an increase in pressure within the cranium, then there's only one place to go, and that's down. And so, so where I'm pointing is the only exit, and you can see that that is where the brainstem is. And so if for whatever reason there's a tumor, there's an obstruction of the outflow of cerebral spinal fluid or anything, it can, or if there's a bleed, it pushes down this way. And if there's enough pressure and it's not relieved, then the brainstem is going to get compressed. And your brainstem is what controls your breathing, your heart rate, your living functions. And so that is one way that head trauma or anything that causes an increase in pressure within the cranium can really damage or even cause death. So let's go over a case. A 27-year-old man who was punched in the face and fell back, striking the back of his head on the ground. An autopsy demonstrated fracture of the occipital bone and extensive contusions over the frontal and temporal lobes. Okay, so anytime that you're looking at a brain, usually if it's in this section, the top part is where your like eyes and your nose and your face would be, and the back part is where the back of your head would be. And now this image is of a brain, but it's from the underside. So imagine we just took off the whole body and we're kind of looking up. You can see the cerebellum back here, which is in the back of your brain, but at the bottom. And then you can even see the temporal lobes and then the front of the brain. And so looking at this brain, he, trying to figure out the mechanism of injury is important. And so this man struck the back of his head on the ground. And so why does he have bleeding in the front of his head where his frontal lobe is? So this will be a demonstration of how the brain moves in the head. And you can see how it goes back and forth, and there's even the potential for some rotational movement. All right, so let's go a little bit deeper and focus a little bit more on the structures that are inside the space between the brain and the skull. So we do have cerebral spinal fluid filling the space, but we also have blood vessels that traverse across the space. And for the most part, those are veins. And so remember, in terms of pressure gradient, your arteries have more pressure, and then your veins have less pressure. And so these are low pressure systems, but they are traversing this space. And so the other thing that can happen if you have this brain going back and forth in the skull is that you can actually tear this layer and have a bleed. And so that is called a subdural tear. It doesn't always lead to mortality or to death because it's a slow bleed, but it can definitely cause a lot of damage. And so let's do the next case. A 9-month-old female presents with bruises on her face and blindness. A review of her medical records showed that she had normal vision at her 2-month visit. Her mother is currently hospitalized for psychosis. And so the picture on the left is kind of showing you a difference between a subdural and an epidural. And we'll talk about that in a minute. But the picture of the MRI shows that there's an increase in Hansity back here. And you can see back here, this is looking basically at the, almost at the top of the skull, but this is a bleed right at the back of it. And that's where her visual cortex is. And so this baby had a bleed that actually was there for quite some time, but it was compressing her visual cortex. So even though her eyes were functional, her optic nerve was functional, because it had pressure on that part of her brain, she couldn't interpret anything that she saw. So she was blind. And so the mechanism of action or the etiology of this is a subdural hematoma.
Acute subdural hematomas occur when outside forces, such as the impact from a motor vehicle accident or blunt force trauma, cause the brain to rapidly accelerate and decelerate inside the skull. Movement of the brain stretches the blood vessels that connect the surface of the brain to the dura, the sheet of tissue between the brain and the skull. These blood vessels are known as bridging veins. When a bridging vein is stretched too far, it will rupture, filling the subdural space with blood. This blood is now called a subdural hematoma. The subdural
Okay, and on the right, you can see a drawing. And so you see these bridging vessels that go from in between that space between the skull and the brain. And you can see how those would rupture because they go deep within the brain. And so they get the shearing force whenever the brain wiggles. Now this can happen with depending on the amount of force. So if there's a very forceful movement, so we see this with babies who have shaken baby syndrome or non-accidental trauma. And then we also see it with elderly people who don't maybe have as much force when their head is going back and forth, but because of their age and because of their brain has a certain degree of atrophy, that space in between the brain and the skull is a little bit wider. And so when they move back and forth, there's a bigger potential to tear the bridging vessels. So let's go on to the next case. A 25-year-old man was struck by a baseball on the right side of his head. 4 hours later, he became lethargic, vomited, and developed a left hemiparesis, which is like half of your side of your body is weak, and lethargic is almost like comatose. So this is an epidural hematoma. So the difference between subdural and epidural is arterial. And anytime you have a skull fracture, especially if it's near your temporal bone, like right here, because that's a really thin bone, you have the potential for an epidural bleed, which is arterial, because the arteries travel within the skull. And so this is really serious because, arterial bleeds have a lot of pressure. And so you can have, rapid pressure buildup within the skull. And that's what happened. The brainstem probably, herniated and this person died. It also looks different on imaging. So you can see there's kind of this egg. The subdural bleed is so small, is so slow and low pressure that it doesn't do the same thing. Now, epidural is like turning on the hose full blast, and so it's going to push everything out of its way and make this huge egg shape. So here you see again this like egg shape, and then this is kind of more of a settling. And then you can see on the right, the arteries that are kind of just following along the bone. And so someone who has an epidural hemorrhage, the case is going to, it probably involve a fracture of the skull because it's going to, have something to do with that. Probably involve a significant amount of trauma. And then also they're going to rapidly develop symptoms and die if not treated. So this, our last case, it took 4 hours. This is probably what happened to the police officer who was hit in the head with the fire extinguisher. He was able to walk back to his office and then died. It was probably because he had an epidural bleed.